Nutrition is a basic right for everyone.
If our young people are not strong physically, mentally, ethically, it's not possible to think about our good future, about our healthy future.
Adolescent health and nutrition has definitely been neglected.
It's the time to build our body, it's a time to build our mind, it's a time to build as a leader mentally and physically also.
The problem has really transitioned over the years. We are moving out of poverty little by little, but now the focus has to be in terms of what kind of information are we giving to adolescents for them to have the right food.
Education and government politics are the two main things that should be adopted by all countries around the world.
Malawi,
India,
Bangladesh, and
especially in Madagascar,
our food system is not adolescent friendly, is not youth friendly.
It leads to a vicious cycle in which bad food means bad health, means more stress, potentially more bad food in the future.
Nearly 20% of adolescents in China are overweight or obese. I urge introducing food education into the classrooms.
my call to, first of all, the governments would be that invest in prevention rather than cure.
The change that I want to see in adolescent nutrition systems in my country is that foods that have high nutritional benefits must be more affordable and accessible.
We should give emphasis to the youth nutrition, to the youth health, and to the youth rights.
I see an opportunity here that right now I think the world has kind of opened their ears for young people to be listened to. So we need to capitalize on this opportunity for young people to come together and speak with one voice in terms of what do we want in our communities.
we need more young people to be involved.
Have them in the room, give them a seat at the table, because they are going to be not only the future, but they're also the present.
Nutrition is a
Hello, everyone. My name is Richard Horton from the Lancet. Welcome to the launch of the Lancet series on adolescent nutrition. Thank you so much for joining us today. I believe that I can promise you 90 minutes of provocative science and discussion about a subject that quite literally, and this is no exaggeration, quite literally will shape the future of humanity. In medicine and in global health, too often we exist and live comfortably within our silos, our academic, our clinical disciplines, which are walled off from one another. And the purpose of this series that you're going to hear about today is to tear down one especially damaging wall, and it's the wall that exists between adolescent health and nutrition. Because sadly, the difficult truth is that adolescent underweight and overweight are not only overlooked in discussions about sustainable development, but they're also severely starved of financing. So quite seriously and quite extraordinarily, the medical, public health, global health, policy, and political communities are paying far too little attention to issues that will determine the future health and well-being of succeeding generations. And the goal of this series, and it's an ambitious goal, but it is our goal nevertheless, is to erase that complacency and to trigger not only attention, but also action on the messages and findings that you're going to hear about in the next 90 minutes. So let's get cracking. Let me introduce you to our first four speakers. I'd like to thank them publicly for their tremendous work. I remember our first meeting that we held at the Wellcome Trust when we were allowed to meet face to face in a seminar room to discuss the series, plan the series. And a lot of water has gone under the bridge since that first meeting, of course. So welcome to Professor Shane Norris, Research Professor within the Department of Pediatrics at the University of Witwatersrand in Johannesburg in South Africa. Dr. Lynette Neufeld, who's Director of Knowledge Leadership Team at GAIN, that's the Global Alliance for Improved Nutrition. Dr. Purnima Menon, who is the Senior Research Fellow at the International Food Policy Research Institute, and of course, our longtime friend, colleague, associate partner in every possible way, Professor George Patton, who is the Professorial Fellow in Adolescent Health Research at the University of Melbourne and Murdoch Children's Research Institute in Australia. So let me go straight to Shane, who's going to kick off this discussion. And thanks once again to all of you. Shane, over to you.
Thank you, Richard. So good morning, good afternoon, good evening, wherever you may be in the world today. Thank you for the opportunity to give some of the highlights from paper 1 in the series. In this paper, we particularly synthesized quite a substantial body of work to document the biology of adolescent growth and development and understand how nutrition impacts these physiological processes. We also sought to obtain longitudinal data to help us understand the relationship between growth and adolescent development and nutrition. Next slide. So today in the world, we have the largest number of adolescents in human history, and many of them, or most of them, live in low middle income countries. Next slide. Adolescence is indeed transformative. It transforms organs, systems, and physical development. In adolescence, on average, 20% gain is achieved in final adult height. About 40% of bone mass is laid down during this period. Adolescents gain about 50% of adult weight during this period. And the brain increases in size and has a proliferation of neuroconnections and pruning and further developing neurocircuitry. In addition, adolescence further develops and matures physiological systems and organs. Next slide. And nutrition has a profound direct and indirect impact on these physiological processes. It can act by influencing puberty, and changing time and duration can influence the outcomes on these systems, but it can also impact directly on the process as well as the organ development. In particular, it can stunt linear growth, it can weaken the skeleton, influence body composition, and the series documents how it impacts brain neurocircuitry, systems like immune development, cardiorespiratory, and also how it influences the next generation. So when these adolescents have children of their own, how undernutrition or malnutrition in this period carries over to the next generation. Next slide. In the backdrop of significant undernutrition globally, we are seeing the emergence, as Richard said, of overnutrition. In this slide, with data of over 50 million adolescents globally, we've arranged the data first, as you can see, going from the outward circle by region. We then arranged the data going from inner radius to outer radius by age, from 9 to 18. And in this case, we're particularly showing data from girls and their BMI Z score. We then colored the BMI Z scores. So white is kind of at 0. And as they progress in higher Z score, the shade shifts from yellow to deep red. And if they're underweight, it shifts from light blue to dark blue. As you can see, which is the most striking feature of this schematic, is how much the global data shows yellows deepening into reds. and this is prolific in both low middle income countries and high income countries. The Lancet paper 1 also provides evidence that across the late childhood and early adolescence may be a real opportunity during this period to promote healthy diets and prevent obesity in later life. Next slide. And to conclude, I'll leave you with this quote from paper 1. At a time when a rapid nutrition transition is shifting diets for most young people globally, improving adolescent nutrition provides an opportunity to shape the health and well-being of this generation and the next. Thank you, and I hand over to Lynette.
Hello, everyone. Welcome, and thank you for joining us. In this paper, paper 2 in the series, we aim to elevate the importance given to adolescent dietary intake and food choice, bringing a developmental perspective to inform policy and programmatic actions for improving diets. We use existing dietary data to illustrate what is currently known about dietary intake, draw on existing literature to map how food choice can be influenced by the unique features of adolescent development, and used pooled qualitative data to explore ways in which adolescents' development can interact with socio-cultural context and the food environment to influence food choice. Next slide, please. Reanalysis of dietary intake from large surveys in India, China, and Mexico illustrated several key points that I would like to highlight. Diets among adolescents may be highly diverse, even within countries by gender, economic status, and region of residence, as illustrated in the work that we did in India. Positive dietary trends, such as increasing dietary diversity, may coexist with negative trends, such as increasing consumption of ultra-processed foods, as was illustrated over the past decade in China. And in some countries, unhealthy foods are consumed regularly, for example, with over 60% of adolescents in Mexico consuming sugar-sweetened beverages daily, and over 30% of their total dietary energy intake coming from ultra-processed foods. In general, however, few countries have sufficiently detailed data on dietary intake of adolescents to identify the issues and inform appropriate solutions. This is illustrated on this world map that we generated of data availability, including a large systematic review of all sources of dietary intake data. And what we found is that looking across Africa, many countries have no data whatsoever on adolescent dietary intake. As adolescents age, their food-related behaviors shape and are shaped by the consort of social, cultural, household, and individual factors. The context in which adolescents live, however, are highly diverse and dynamic, as is their level of autonomy and agency, and the timing and process of transition into adult roles and responsibilities. These changes have important implications for adolescent diets, including who purchases food, with whom food is eaten, and even access to some foods, with such changes driven by gender roles in some contexts. Next slide, please. We explored these influences, pooling data from 11 studies in 8 countries from around the world, and complementing this with evidence from the literature. In all studies, researchers spoke with adolescents about the food they consume and why they consume those foods. Because context has such a fundamental consideration in food choice, we analyzed this data separately by the food environment using the classification of the high-level panel of experts as mixed, modern, and traditional food environments. I would like to highlight several key findings from this analysis. While adolescents have autonomy and express agency across all food environments, their centrality to food choice is much stronger in modern than traditional food environments. In traditional food environments, there was a consistent narrative of family and community priorities, often superseding individual considerations. While availability and affordability and desirability of food emerges as drivers of food choice across all contexts, their relative importance are substantially variable across the context. In modern food environments, adolescents often choose themselves a substantial amount of the food that they consume over the course of the day, and desirability was quite central to those decisions. However, even the meaning of some of the constructs that we studied varied by context. For example, affordability in modern food environments was synonymous with perceived value for money, whereas in traditional food environments, adolescents were keenly aware of the precarity of their economic situation, and affordability implied simply the lack of economic resources to purchase such food. In these environments, adolescents are active members of food production, preparation, and income generation for food. Across all food environments, more than its healthfulness or tastiness, food was valued for its role as a central part of sharing in social times with friends, and in some contexts, also sharing time with families. Next slide, please. In conclusion, urgent action is needed to harness the shared values and motivations around food that is central to food choice decisions among adolescents across all the contexts we studied. This must be done not just for adolescents who have much to say about why they eat and what they eat and why they eat it. Adolescents can be empowered with knowledge, skills, and motivation to navigate towards healthy and socially appealing diets. But there is also much to do to protect adolescents and enable healthy food choice. Nutrient-poor, energy-dense foods are far too readily available, inexpensive, are appealing, and often socially alluring for adolescents, while healthy foods remain insufficiently accessible in many contexts. Regulations are urgently needed to curb advertising of unhealthy foods, often covertly so on social media, and to restrict the sale of unhealthy foods in schools. For populations living in situations of vulnerability, the nutrition of adolescents is highly precarious, and actions, including social protection, should be explicitly designed to address this. Thank you.
Thank you, Lynette, and Shane for that fantastic introduction as to why we should care so much about adolescents and young people in our quest towards nourishing the future. I'm really pleased today to present paper 3 of the series, which is the final paper that outlines strategies and interventions to support healthy adolescent growth, nutrition, and development. And I present this paper on behalf of all paper 3 co-authors. I'd especially like to call out Dougal Hargreaves and Emily Mapes, who were lead co-authors on this paper, and the phenomenal contributions made by our co-authors from the 2 countries that carry the largest population, perhaps, of adolescents and young people today in this world, collaborators from India and China, and our amazing other researchers. It was a challenge to put this paper together because what we were trying to do was to bring together the evidence on what works and use that to help us think about what lies ahead. Next slide, please. What we aimed to do in this paper was review evidence on actions to support better nutrition for adolescents and young people. We aim to explore the role of multifaceted interventions. We aim to assess the data landscape for adolescent nutrition because we know that without data, we're flying blind. And we aim to put all of this together to identify what we should do looking forward. The period of adolescence that we're looking at in the context of the series runs all the way from age 10 years to 24 years. That is a very long period of an individual's lifetime. Across this period of life, adolescents and young people spend their lives in educational settings, in interactions with the health sector, in daily interactions with the food system, whether it be in their own educational systems, at homes, or where they live. And their choices are influenced tremendously, and their opportunities to consume healthy diets are influenced by their communities and other social influences. And so our evidence review focused on these 3 domains, or these spaces that are inhabited by adolescents as they make their way through this long 14-year period. To do the evidence review, one of the things we did was actually rely on take the approach of reviewing reviews, because there is a reasonable amount of evidence out there that has been synthesized. And we brought it together in a way that helped us understand the kinds of malnutrition challenges that were addressed by the different interventions, programs, and policies that had been tested in research. And we tried to examine that evidence from the perspective of building a link to paper 2 in particular, to look at the extent to which interventions and actions, A, address the food environment, and B, addressed the adolescent agency and autonomy around choice of food. Next slide, please. Our findings, which I won't go into in specific detail, although we spent a lot of time looking at specific interventions in relation to specific nutritional challenges and in specific spaces, as I mentioned. Those are summarized in table 1 of interventions on page 3 of the paper, and so I encourage us to look at that. But I think what really came across from what we reviewed is that very, very few efforts were looking at adolescents and young people as they traverse this long period of their own lives. Very, very few people or researchers or real programmatic efforts were looking at the entire period, were looking at multiple forms of malnutrition, or were looking at this intersection between the food environment and individual agency. And so in a sense, where we land with our recommendations are not to offer the global community a list of specific interventions to take forward, but to really make a profound call for us to focus on multifaceted interventions that treat the adolescent as a whole, that treat the journey that they traverse from age 10 to age 24 as a journey, and therefore that look at this with the perspective of preventing multiple forms of malnutrition, and doing so by improving both the food and nutrition environment and addressing issues that pertain to individual and families' agency to engage with that food environment. We fear that if we take a reductive perspective that focuses on individual forms of malnutrition and individual interventions, we will not serve our young people well enough. Next slide, please. One of the things, as we mentioned, given this long period of time, is that schools and educational platforms are a tremendously promising way to reach adolescents and young adults over this entire period of time. There is a plethora of evidence on how to make schools and educational platforms work better to tackle malnutrition. They do so in multiple ways. They shape the food environments that children are exposed to. They act as social safety nets to support poor children. And they teach children, or they have the potential to teach children about healthy diets. Unfortunately, today, too many children have been left out of school and left out of educational platforms because of the pandemic. And we want to call this out as one of the biggest challenges to enabling us to look forward. Next slide, please. I want to close with how challenging it was for the paper 3 team and the series team to pull together our recommendations, because these recommendations are based on data that is still too fragmented, on research that is really a smattering across the range of different challenges and the range of age groups that we are looking at. And so quite a lot remains unknown. We certainly do not recommend that we don't act, but we do recommend that it's critical to address both data and research gaps while acting swiftly. Adolescent nutrition problems remain largely invisible because data sets do not capture most of our age groups. This makes it very difficult to set targets and to track challenges. And secondly, even though we recognize and we feature some very interesting multifaceted and multisectoral actions in the context of the paper and note that they offer great promise, we also know that research is truly limited on these. And so we call on researchers and we call on funders to help some of these, close some of these gaps. With that, I will close and hand over to George.
Thank you, Shane. Thank you, Lynette. Thank you, Purnima. It should be very clear, I think, to all of you now that adolescence is a time of enormous growth. And just to repeat some of those figures from Shane, 20% of adult height, 50% of body mass, 40% of bone mineral density is acquired at this phase of life. And as you've heard, adolescent nutrition carries implications for health right across the life course and into the next generation. It should also be clear that the world's adolescents are at a nutritional tipping point. Old problems persist at the same time that obesity and metabolic disturbance take on a global dimension, with no country yet managing to turn that tide. So the series framework, my computer is telling me I need to unmute myself, but I think you can hear me. It should be clear, the series framework on the right captures a bigger picture of some of those forces that are shaping adolescent growth and nutrition. It takes that intergenerational life course perspective and it combines it with an ecology of the drivers of food environments, all the way from natural ecosystems down to the households in which adolescents are growing up. And it also incorporates that two-way interaction between adolescents, young people, and their food environments. So in making the series recommendations, we considered the need to act within this bigger picture. So our three groups of recommendations address visibility and accountability, creating healthy food environments, and lastly, the role of young people themselves. Next slide. So the first group of recommendations concern visibility and accountability. Now, the graphic on the right, I don't expect you to read it. It comes from paper 3 and is really around this question of data availability at different ecologic levels and across different global data sources. Now, there's a take-home message here, and it is that our databases are largely missing nutritional data for adolescents at all levels, from ecosystems down to the individual, with only the Pop Council's Adolescent Data Hub doing a little bit better. So this all reflects that adolescent nutrition until recently has been nobody's responsibility, not policymakers, not clinicians, not donors, not researchers. We have not developed the processes, the workforce, the technical and data systems that exist for younger children. So in achieving visibility and accountability, we recommend three things. Firstly, to WHO and its UN partners, you need to set global targets for both adolescent undernutrition and overweight and obesity. Without targets, there's little incentive for overstretched governments to collect data and establish accountability mechanisms. Secondly, national governments and their data collection agencies need to put in place national data collections, not only of nutritional problems, but also the drivers of adolescent food choices, as well as the coverage of interventions and programs. Currently, only 28 countries, half of them high income, have coverage down to a subnational level. Thirdly, we recommend donors and research funding agencies invest in filling the knowledge gaps, ranging from the relationship between nutrition and growth through to the trialing of interventions that can be implemented and scaled in real-world settings. And given the rapid changes in food systems, we need these investments urgently. Moving on to the next slide, please. A second group of recommendations concerns the actions to create healthier food environments for adolescents. And we recommend, firstly, national governments, state jurisdictions, and local governments extend their use of fiscal and policy levers to promote healthy diets for children and adolescents. So some of those actions might be extending taxation to high energy, nutrient poor foods, promoting the affordability and availability of healthy foods. There is that figure in paper 2, a 10% reduction in price brings a 12% increase in the consumption of healthy foods. Greater regulation of marketing of unhealthy foods. National and state jurisdictions must take action here, and local governments are also important. You can restrict fast food outlets within neighborhoods, particularly in those operating near schools. We have recommendations for researchers. You need to work more closely with consumer groups and shareholder activists to hold the food industry accountable for their policies, including their marketing to children and adolescents. This holds for transnational companies right down to local manufacturers. We need to tackle food insecurity, and governments need to act here. It was already a pressing problem, but it's worse with the COVID-19 pandemic. It has profound effects on the life chances of both boys and girls. And paper 2 gives examples of girls taking on transactional sex and boys' dangerous work in order to respond to household food insecurity. Investment in nutrition-sensitive social protection should be a priority for all governments, particularly in the context of planetary change. Kaneem's already said it. Ministries of education and school systems have a really important role in nutrition. So children in many countries are spending close to half their waking hours in school. So that means that schools are not only a place for acquiring knowledge and skills to make the best possible food choices, but are an important food environment in their own right. The investment in creating health and nutrition promoting schools presents a win-win in that nutrition is essential for learning and cognitive gain. Finally, national governments should ensure that young people have access to accurate nutrition information through simple, bold, front-of-packet warning labels and social media messages designed in partnership with young people. Moving on to the last slide. The last recommendation is really around engaging with young people as partners in advocacy. The interviews with young people that accompany this launch really indicate that young people not only want to make healthy food choices, but understand that their food choices link to other agendas that are important for them, including mental health and body image, how we treat animals, and of course, the effect of food production on Earth's ecosystems. So those are our recommendations, and I'm going to pass you back to Lynette for the panel.
Thank you, George, and for the other presentations, Purnima and Shane. We are ready to hear some input from some of our distinguished colleagues who are here with us today. Just very quickly introduce our panel. We have with us today Dr. Francesco Branca. He is the director of the Department of Nutrition and Food Safety at the World Health Organization in Geneva, Switzerland. We have Dr. Juan Rivera from the Executive Director of the National Institute of Public Health in Mexico. Dr. Seth Adu Afarwa, who is a professor at the University of Ghana. Dr. Miriam Cleason, professor at the Global Public Health Department at Karolinska Institute in Stockholm, Sweden. And Sophie Haley-Tho, who is a youth advocate with Act for Food, Act for Change. So as you know, I will ask each of you one question. I'm going to go in the order that I just presented each of you, and then let's continue on the discussion from there. So I'm going to start with you, Francesco. You wrote for us a really nice commentary. We're very grateful for the commentary that you wrote about the series. Can you speak to us a bit about how can this series and its recommendations help move policies and programs forward to improve adolescent nutrition?
Well, thank you, Lynette, and congratulations to all the team for the excellent series. At the moment, we have one framework for nutrition, which is the Comprehensive Implementation Plan on Maternal, Infant, and Young Child Nutrition. That framework is really looking at the whole life course, but then it's true, it focuses particularly on children under 5. The Non-Communicable Disease Action Plan is target for adolescents obesity. And then we have an accelerated action for health of adolescents, which is of a broadly encompassing all aspects of health. But it's true that this focus has been missing. It's the right time because countries are changing their attitude toward adolescent nutrition. We have more and more a shift from the old way of looking at things simply considering macronutrient malnutrition to now looking at all forms of malnutrition. And we have really an interest to look at adolescent food environment with multiple policies. So I do believe that the recommendations of the series resonate certainly with us, with WHO, but resonate with governments. And I would say that what can be done is certainly to look at outcome targets. I do agree that those outcome targets are important, to be very concrete about the priorities. Second, work on some of the policy changes. I do believe that, for example, when we talk about actions in the health systems, at the moment, essential nutrition action really focus on macronutrient malnutrition. We know more now on obesity. We've seen how a well-designed obesity management service can be done and can be producing an impact. And then on the food environment side, definitely the school aspect, the school focus could be particularly impactful. As a result of the UN Food Systems Summit, there is a large coalition on school food being formed. That might mean that we are going to be able to offer healthy and sustainable school meals to many more children. There's going to be an investment on that. So I do believe that many of the recommendations made in the series, which are extremely well motivated, will be able to influence the policy agenda through a specific policy document, but particularly through health actions. And I think that the leadership of youth would be particularly important to make this happen and to make this request not only to the international organization, but to the national governments.
Thank you very much. I think we'll come back to many of those points, I suspect, over the course of the discussion. Juan, Mexico has implemented already several of the policy initiatives that we've been discussing that are intended to support dietary shifts in the population. As director of the National Institute of Public Health, how might you use this series' findings to support the government to improve actions more specifically for adolescents?
Well, thank you very much, Lynette, and congratulations for this amazing publication. And I think that something very important is that this series highlights the importance of nutrition in the maturation of major physiological systems during adolescence, and also points out the neglect in this topic. And it's very important then to translate these two programs. Now, how might this series enhance our policy? I would say not only in Mexico, in Latin America. Well, the first thing is that the series addresses drivers of food choices, including the strong interaction with food environments. This is something new. It's really a contribution. It recommends actions needed to create healthy adolescent food environments. And this is really very important. Identifies the need to tackle the multiple drivers of adolescent food choices rather than isolated actions. And given that Latin America is, as you mentioned, the area in which overweight and obesity is very prevalent, the intake of ultra-processed food is high and growing, our region has been leading the implementation of several policy actions. And how can we then improve that policy? Well, we are in line with the recommendations to restrict access to unhealthy foods through taxes, through marketing restrictions, regulation of food school environments, warning labels. And we agree that we should build these toolkits. So it's not only a single intervention, it's a package of interventions. Now, there are very important recommendations that George Patton made very, very good summary today. And I will choose 5 of them that I think that will improve our policy in Latin America. The first one is, given the autonomy and agency of adolescents, there is a great potential for adolescents to be active drivers of change in food environment. So the recommendation to design programs with the active input of adolescents is very important. We haven't done that in Latin America, and we should do it. The second one is that we have restricted advertisement mainly in TV and movies. But adolescents are subject to a bombardment of multimedia advertisement, as mentioned in the series. And the series recommends regulation of advertisement in social media. This is a very important recommendation, difficult to achieve, but very important. Then there are two additional recommendations that are very difficult to implement, but I think that very important. One is that researchers should partner with consumer and stakeholder activists to hold food manufacturers and distributors accountable for their food policies and marketing directed to children and adolescents. Very, very strong recommendation. And that all actors on the food system must support healthy food environment and restrict sales of unhealthy alternatives. Food industry has been the main obstacle for advancing policy in Latin America and are a very powerful force with great influence on decision makers. The only way to implement these important recommendations is to build strong global partnerships to support national efforts and counteract the powerful influence of food industry. And then finally, given the role of our food systems on the degradation of the planetary systems, we in Latin America are trying to implement policies to transform our food systems and make it not only healthy, but sustainable. And the series points out that a growing number of young people activists are highlighting the effect of the food system on the planetary ecosystems. So I think that young people have the potential to unlock the political and policy paralysis around the sustainability of our planet. I think those recommendations would be very important for Latin America. And thank you again. This is a very, very good publication.
Thank you. Thank you very much, Juan. Seth, you're working as a researcher and a lot of calls for new and more evidence. Tell us what you think and how can this help this series that highlights so many evidence gaps from all the way from the biological through to the implementation research to enhance the design and delivery of programs. How do you think this series will be successful? Do you think the series will be successful in promoting additional research to address these gaps? And how will it influence your own work at the University of Ghana?
Thank you, Lynette, for this question. And I would like to congratulate your team for coming up with these papers. You see, not too long ago, we saw how the Lancet series on maternal and child undernutrition brought attention to the neglect hitherto suffered by maternal and child undernutrition. And then almost immediately, that effort catalyzed the work needed to put maternal and child nutrition on the global agenda. And then we saw how those series of papers helped galvanize support, including the support of researchers, to try to accelerate the reduction of undernutrition as well as overweight and obesity in women and children. So I expect a similar thing to happen for this series on adolescents, growth, and nutrition. I think the series will serve as an excellent advocacy tool to prompt the research needed to address these gaps. And then you asked how this would influence my work as a researcher at the University of Ghana. My research here have focused so far on maternal and child nutrition, including the prevention of micronutrient deficiency. It is great that in Ghana, adolescent nutrition is already being prioritized. Currently, there are 2 major school-based interventions being implemented by the Ghana Health Service and the Ghana Education Service, with funding and technical support from UNICEF and other partners. The first is what you call the Girls Iron Folic Acid Tablet Supplementation Program to reduce anemia. And the second is the Nutrition Friendly School Initiative to promote healthy nutrition habits, hygiene and sanitation and physical activity in schools. And in the coming years, there are plans to expand these programs. And I believe my colleagues and I, as researchers, are happy to participate in the implementation research needed to support these programs. And I'm sure we will begin to see more of these kinds of collaboration in our region. Thank you. And I congratulate your team one more time.
Thank you. And it's good to hear about the program that you mentioned around education. That was one of the messages that came out quite strongly, is that importance of not only the development of the skills and the knowledge, and then going beyond that into creating that motivation. So great opportunity there, I think, to build on some momentum that's already happening. Miriam, nutrition has been a chronically underfunded area, particularly for adolescents, as we've been hearing already. In this series, we're calling for a substantial increase in actions to address adolescent nutrition. How do you think donors are going to respond? What more do we need to do to get their attention and their investment?
Thank you so much, Lynette, for this opportunity to discuss donors' responsiveness. And putting on my old hat, I must say that donors and all stakeholders in general respond well to evidence for impact. They want to know what works and what doesn't. And clearly, as we have heard from my co-panelists and presenters, this report builds on previous evidence, but also deepens our understanding for the importance of the particular adolescent period in growth and development. But the report also points out, importantly, what does not work. And that is to continue to invest in a single interventions in a single sector without addressing the contributing factors and other drivers that are important for impact at scale. So I think what's really welcome is seeing some of the synthesis in this report, sector by sector. What are some of the best buys in health, in education, in food systems, in influencing communities and social influence? And that is exciting, as is this opportunity to maximize investments, which of course also donors want to see. They want to see their investments leveraged. And I think this report provides several examples of very important synergies. Take the example, for example, of the intake of unhealthy beverages and food, where the report shows how a combination of instruments can make a difference, right? Taxation, regulation, and public education. And I think that is really welcomed as we try to understand how to indeed to maximize our investments. Now, the report also point out what's more is needed, as you asked, Lynette. Clearly, adolescent nutrition has to become visible. And I think this event, and coupling this discussion to the Global Nutrition Forum, is an important way to give visibility to adolescents, but also ensuring that indicators are included and targets, measurements, indicators and targets in global databases, as George pointed out, and in the current new large investments and initiatives in nutrition, where the focus on adolescent nutrition is still not there. So here is an opportunity. I think also, as has been pointed out, we do need some knowledge gaps to be addressed. There are still questions, but those are basically around implementation questions. So by investing now in implementation, coupled with implementation research, that is going to help us move the agenda forward, and it's no reason to wait. So putting on my previous investors hat, I do think right now it's really a good time. This report is coming out at a very critical time point, and I think timeliness and timing does matter. The fact that there are new initiatives globally with funding, this provides an entry point for this report to influence and ensure that adolescent nutrition are included in those large investments. I also think, as was pointed out in the introduction, that this highlighting other areas in focus like climate change and showing the linkages to other important issues right now really works for increased attention to adolescent nutrition, couple it to other issues. And I would also like to say that this report helps us shift from food to food intake to food choices in adolescence. And I think, again, that will resonate with so many. This focus on food intake in adolescence, because that also put the adolescents central to this. Finally, Lynette, I would like to say this question about donors. Donors are many different stakeholders. There are many different investors, financiers in the donor landscape, potential new and old friends of nutrition. And I think it's so important at this point to emphasize the most important financier and investors, and that is ministers of finance. It's governments allocating their budget for adolescent nutrition. So let's not forget that they don't only play a key role as coordinators of multi-sector action, but as investors expressing the commitment of governments to this issue. Bilaterals, multilaterals, multilateral development agencies have an opportunity here to really move the human capital agenda forward. This provides an opportunity to build human capital. NGOs, charities, foundations, all key partners have an opportunity here to see their investments amplified. And of course, our friends in the private sector who are interested in impact investment, here is really a case for impact investment. So I think the timing is right. I'm very optimistic, as you can hear, Lynette. And I think that moving towards more collective action with countries in the lead at the center with youth is really a perfect opportunity to move an agenda that's been missed, neglected, and that we have failed to really put at the fore. So thank you.
Thank you very much. It's great to hear your optimism and some very, very wise words for us to move and advance this agenda. Sophie, to you, you've been a strong youth voice advocating for nutrition for some time, perhaps even before it started to become popular to do that, which we think is just fabulous. Working with adolescents is central to many of the series recommendations. How can we make that involvement meaningful and avoid tokenistic involvement?
Thank you so much, and thank you for engaging young people in the Lancet series. It's quite unique to do so, and I think it's a turning point for youth priorities in the nutrition sector. I think over the past 2 years, we've seen specifically one message from young people, whether it be on the streets, for climate change, whether it be in the halls of the FAO at the United Nations Food Systems Summit, whether it be at COP26, and that's nothing about us without us. And civil society, the private sector, researchers, they are key partners, but young people also need to be seen as a key partner, and they need to be engaged in the journey from the beginning to the end. And when we look at this, we also need to think about the language we use, whether you're a researcher or you're a decision maker, to ensure inclusivity of all young people. Language in research is fundamental. We also can't just treat young people as young people. They can't just be that box ticked off in the room. They have to be engaged at every single level. They need to be part of intergenerational and multi-stakeholder conversations. They aren't just young people, they are people with a future, and they are stakeholders in the design of their futures and the world's future. They also need to be part of the follow-up, have young people involved in designing and implementing effective strategies and interventions, and embed the work you do with them in their settings. They shouldn't have to come to you. You need to go to them in their settings. And if you do any work with them, they need to be recognized for the work they do. To build trust, I think this is really important. If adolescent nutrition has been missing from global targets since the launch of the Sustainable Development Goals and before, how can you expect young people to trust you that you will ensure that adolescent nutrition targets remain a priority or even become a priority for decision makers, the government and the private sector into the future? So recognizing the work of young people is really, really important, and to ensure that you don't take them for granted, because these are young people with lives to live, and they're very busy people. So to ensure that they're not taken for granted, I think is also really, really important.
Thank you. We don't have time to do another round on this panel, but I think we're going to be coming back to many of these points in the question and answer that will follow. I do want to just highlight a few things that I think we should make sure that we pick up, George, in this next section. We heard a lot about evidence and targets. Seth highlighted the importance and how critical the previous Lancet series on the 1,000 days on maternal and early childhood nutrition was. But central to a lot of that was the fact that we had WHO guidelines. We had the evidence to take forward specific nutrition actions. We do have a lot of evidence here, but we also have highlighted a lot of evidence gaps. And this might imply that we need to work with guidance, and we need to work in generating that evidence simultaneously as we act, as opposed to sitting and waiting for further evidence to be developed. It has to be happening simultaneously. And I think looking to what's been happening in Latin America, where you are implementing policies and programs, evaluating those in real time, and then taking them to scale and adapting in accordance with those results is really quite fundamental. Putting governments at the center, I think, again, it's a great example of what's happening in Mexico and across many parts of Latin America. And that is centrally and fundamentally driven by what is the government is seeking to move forward, and it's an important approach that we need to see happening elsewhere, everywhere. And then just finally, Sophie, really grateful for your words, and going to them. I think that's maybe our biggest challenge as somebody working on the cusp between research and programs, understanding what that means and getting ourselves out of our comfort zone and getting into the spaces that young people are living is going to be a fundamental challenge and an opportunity for us to get this right. So with that, over to you, George, and look forward to continuing.
Thanks, Lynette. Those are great points. Look, it's been great. We've got been following the Q&A boxes. We've got some terrific questions that are coming in on some of those points that you've already flagged, Lynette. I'm going to start with that question about government and government action. And Susan Sawyer raised the first question, which was about whether countries are acting and governments are acting quickly enough. And she gives the example of Indonesia. So in Indonesia, it's not been a tenfold increase over 4 decades. It's been a tenfold increase over 1 decade. In terms of rates of overweight and obesity, researchers are actually looking to work in this field. They go to the government says, no, the main problem is still undernutrition, and that's where we need to be focusing our investments. So question, which I'm wondering, Lynette, about you, I'm also wondering about Mariam, sort of also Francesco, whether you'd like to comment on this. How do we get governments to move quickly enough? Who'd like to kick off?
I can kick off with one thought, and that is the targets. I think they've been mentioned several times already, but so fundamental. If there isn't something that we are being held accountable for why should we act in that direction? What is the impetus with so many problems to address at the same time? If we're not being held accountable for actions and we're not driving towards specific goals, I think the risk that it falls off the priority list is very high. With that, I think Francesco has his hand up.
Over to you, Francesco.
Thank you. It's a great question, and definitely we need to make this as a priority. I mean, the target, one of the targets, I mean, the one on adolescent obesity is there. It's not prioritized among other targets, but I think we need to explain. You know, a country like Indonesia, I mean, there's been a series of action plans that have been focusing on undernutrition. It's not easy to change entirely the narrative and to make the public health case. So we need to make that public health case. Number two, we have to have clear policy guidance. So it's not about only the nutrient aspect. It's about how you get there. And so, we heard about marketing. We heard about front of the pack labeling. We heard about fiscal policies. So we do actually have that package. They need to be made a guideline, and they need to be made an essential group of policies that all countries take. I think definitely this is, there is a role for the international agencies to do that. Third, how do you get this done? There should be some peer pressure. I mean, as a result of the UN Food Systems Summit, we've seen that we're starting to see coalitions. I mentioned the School Food Coalition. We're actually trying to set up a healthy diet coalition exactly with that package. We want to have more countries joining and more countries even providing peer-to-peer support how to do that. If you see what has happened with the Mexican experience of fiscal policies or with the Chilean experience on labeling, I mean, it's spreading because of the good experience. And finally, the leadership of the youth. I mean, having a movement of youth, going in the street, not only saying, we want to have a future with less impact on the climate, but to have a future which is also made of healthy diet. I think that's going to be a major game changer.
Mariam.
Yeah, first I must say I think that for countries to develop a strong investment case for adolescent nutrition with adolescents as active, engaged in that process, of course, is very powerful in how we take that step forward in increasing government investments in nutrition. Now, as far as I know, Indonesia has made nutrition a priority. How one then allocate the allocative efficiency, as my economist friends would say, that's where reports like this come in to provide the evidence for how do you allocate across sectors. So I think in that sense, this report is helpful in moving that agenda forward. But I think one should acknowledge that Indonesia has indeed recognized that nutrition is a multi-sector issue and is trying to really tackle that as part of its human capital agenda.
Thank you all. That question about young people and them acting as a powerful force is something that's come up in a number of questions. Aisling Daly has raised the questions about peer influence. Jody Harris, you've raised a question about, well, have we actually got the balance wrong here? Sort of a food environment's really going to just overwhelm sort of any agency that young people can take in relation to their food environments. And we did think about that, I want to say, Jody, in the sense that we recognize that younger adolescents probably do have less agency and autonomy than older adolescents. We thought about trying to build it into the conceptual framework, but it got a bit complicated, so we didn't go there. But we did talk about young people being a very powerful force, particularly in fact acting as a collective. And Haley, I think you've raised some questions of that kind as well. So I'm just wondering, sort of as a question for Sophie, Panima, and maybe Lynette, but Sophie in particular, how do we sort of get the kind of collective action that we've seen around climate change, that we saw in the civil rights movement in the past? How do we achieve that around nutrition, or is that achievable?
Yeah, great question. I think it is achievable. But I don't think that nutrition has been showcased at a level in which all young people realize that nutrition is a big part of climate action and their own health. To a lot of young people, what does nutrition even mean? What are food systems? So to ensure and showcase that nutrition is linked to them and they are an integral part of their own nutrition journey and others. I mean, I put in the chat box just there that, at COP26, any decisions or near decisions made on food have been bracketed for COP27. There wasn't a real food day at COP, and food wasn't an important part of COP26 as we saw. And this is portraying a message to young people that it isn't important when it really, really is. I mean, any true meaningful engagement I've seen on nutrition in countries is led by young people, and they don't even realize how important what they've done is. As Act for Food, Act for Change, and previously they again introduced a Bangladeshi pledge that was led by young people in Bangladesh, and they achieved monumental change in changing the way their education, food system in terms of nutrition was seen. And I mean, we see, I saw also in the Q&A that somebody's asking me what a good organizations work on adolescent nutrition, and there's so many, and they're the ones that are led by young people. They have a board of directors are young people, their communication managers are young people, and the people doing work on the ground are young people, such as Bite Back UK, Act for Food, Act for Change, the Climate Smart Agricultural Youth Network, YPARD, and Bites of Food System Transformation, just to name a few. And these are the types of groups that researchers need to link to ensure that they have a platform in which they are supported.
That's brilliant, Sophie. And I think we need your help and your colleagues' help in how we actually do that. But it does sound, from what you've said, there's a great opportunity coming up at COP27. So we need to be working toward that event. Any other comments on this from other panelists?
So, George, I'd like to come in and really just reinforce, what everything I've heard from Sophie. I think, in a sense, the series and the way we approached it, but also, the engagement that we have with the youth coalitions, is really going to be profoundly important to what happens ahead. The youth have been amazing at mobilizing around climate. They've done that without any help from older people or adults. And so, I just want to say, we look to the youth to also bring that passion, bring that commitment, and we adults need to commit to stand with you in doing that. I think my concern around accountability there, however, is that the food system is made up in a different way than the education systems and the health systems, where governments have a lot of control in some ways, and you can deliver interventions in ways that operate through administrative channels. Food systems are fundamentally private in around the world, and just as the youth have raised issues around climate change and the role of industry and of polluting industries, I think the youth and all of us together have to raise the importance of confronting some of the uncomfortable truths about what is happening within the food system. And so it is for us to stay committed to that cause and to stand with the youth in doing that. I think too many adults are too afraid to speak up. Too many researchers are too afraid to speak up. Too many agencies are too afraid to speak up around these conflicts and the role of industry. And I think we need to do that courageously with the youth.
That's terrific, Benima. Sort of working with Sophie, working with you and young people, but without holding you back, by the sounds of it. Okay, now if there's no further comments on that, perhaps we'll go to some questions that have emerged around data And there have been a range of questions here from Pat McMahon, from Abigail, really targeting, really asking questions of how good is our data currently. There was a question specifically to Shane, how good is our BMI data, for example, that we presented, which came from Majid Izzati, who was one of our co-authors. But also sort of questions about, well, how do we go about improving our data systems? What are the next steps? Do we even know within a fragmented system of data collection what data we have? And this is something which Panima, I'm sort of thinking you might comment here, Francesco, Lynette, you and Shane might all have thoughts on this.
Yeah, I can come in first on this. You know, we absolutely need a data revolution around this. We know too little. You know, our data review, I think, was really shocking, the kinds of gaps that we've seen, and even the best data sets that we've seen. You know, there are no global databases on you know, what is being consumed, leave alone for adolescents. I think there are big global data gaps simply in the area of diets. And so we need a great deal of thought around that. I think the tools to measure what people are eating exist. What's missing is the platforms to collect that data and the investments in those platforms to collect that data. In our paper, we showcase you know, one example of adolescent and youth focused data set from India. But you know, even that doesn't have a lot on the quality of diets, on the food environments, and it was a one-time effort. So I think what we have today in the world are some exemplars, but we need much more scaled up efforts around the data systems.
So George, maybe just to build on from Panima's, certainly the data we used in paper one, so certainly global indicators like growth in terms of height, weight, BMI. We've certainly got data in collecting that data in more regions across the globe. And that particular set of data, which is from over 2,000 studies, 60 million adolescents, is rich in the sense of providing that kind of snapshot. But where we're really missing data is getting much more in-depth understanding between various contextual, social, behavioral factors and the biology. So either the data is in small pockets, often not longitudinal, and often siloed. So a study on adolescence may deal specifically with maybe mental health, but very rare do you get the studies integrating diet, puberty, mental health, and physiological markers. So we still, even though we've seen the picture emerge, we're not seeing adolescent biology as a whole. It's still too fragmented and siloed. We need to integrate our data collection efforts to give a better understanding holistically what's happening, because one element may not only affect an outcome of interest, but may have cascading effects on various other physiological systems.
Thanks, Shane. Francesco, amend one.
No, I agree. The data are really important. As you know, the good source of data is the health behavior in school children data set. It covers 50 countries, but they're all in Europe and North America. There's nothing about low and middle income countries. So we definitely would need to extend a scheme like that. I think, you know, having standardized data collection system which are cheap are extremely powerful. Also for the advocacy we've mentioned there at country level. Then we need data also on some of the risk factors. For example, I mean, you all mentioned the importance of marketing, and you know, we need to understand how pervasive is the digital market is for adolescents, and you know, we're starting to scratch the surface now, and that is you know, something that will guide our policy action much better. And then I think the dietary data. I mean, I have the greatest sympathy for Lynette and team who've done a tremendous effort in trying to get the scanty data which are there. I think we need to have a data-gated instrument. I know that there is an attempt to do an international analysis of quality of the data. If we could have some subset of that information for adolescents, that would be extremely interesting.
Thanks, Francesco. So moving beyond food frequency questionnaires and dietary diaries to easier instruments. There was a question about that. Juan, over to you. You're on mute.
This is not about data, it's about two other questions that were made. So I may wait until you finish the data discussion, if you like.
I think Annette wants to chime in here.
Just very quickly on the dietary data, Francesco, we did actually do a systematic review of data availability, and that will be eventually published, submitted and published as a separate paper. It was quite a task. And most of the data that we found was only on very specific components of the diet. Sugar sweetened beverages, fruits and vegetables, just a few indicators that would allow us to have some vision. Very, very few countries found, had comprehensive diet surveys, and even fewer had more than one data point or data that was representative beyond the national level, which really, really is problematic if you start to think about designing programs and having policies specifically aligned with that. And finally, none of those data sets that had quantitative data, were they combined with the qualitative data on the determinants of food choice. So we can only really make responsive actions if we understand not only what, but why. And that's a really big, important gap that needs to be filled. Thanks.
Thanks, Lynette. Clearly a huge agenda. Juan, over to you.
Yes, there was a question about the relative importance of food environment versus autonomy and agency, which is really interesting because I think that the series, what you do really is to show that there is an interaction. So when there is an interaction, there is not one more important than the other. So it really depends on the context. For example, and it was very clearly stated that in more modern contexts, when food environment is very, very present, you see all the unhealthy food everywhere, then autonomy acts in a way in which the decision is, let's go for the cheapest and tastier food and the more convenient food. So I don't think that that there is one more important than the other, but it really depends on the context. And what I really like about the series is the importance that you really place on food environments and the ways to influence food environments. And then there was Purnima mentioned that the food system is is in private sector hands. So the way that the governments can act is through regulation, unfortunately. So at this point we need to have strong regulations, taxes, banning the presence of these foods in schools. Later on, hopefully, there will be social norms. But in the meanwhile, before they become social norms, I think that this is very important to have regulations. And then the importance of the coalitions of investigators and civil society and young people in this case is very important. I think that in Latin America, we have demonstrated that despite the very powerful presence, the power that food industry has, we were able to pass a lot of laws, despite the fact that a lot of people in the government were against, because there was social movements and they demanded the government for these policies. And I think that that's the way to go. And that's where youth can really come and help pass this type of laws and regulations.
Those are fabulous comments, Juan. Thank you so much for those. And you're bringing us back to a topic where there's a lot of questions appearing in the Q&A. And that's about the regulatory actions that governments should be moving to. There are questions there from Shakil, from Annapurna, from Alison, about where this might need to move to in terms of national government action. There's also been a question, Francesco, about the transnational dimension to some of this marketing of food, both in terms of digital marketing, but also in terms of transnational companies, food industry, controlling the narrative that governments adopt around nutrition and ultra-processed foods. So I'm wondering, Francesco and maybe Seth, if you'd like to comment on some of these actions that governments can be taking at the moment that go beyond sugar-sweetened taxes on sugar-sweetened beverages.
Well, yes. Sorry, go ahead, Seth.
Okay, yeah, that's a good question. I think there are two opposing things here. There are the legal issues related to what people can, the type of things that people can sell legally and in terms of food, and then the nutrition on the other side. And I think governments have the difficulty in dealing with what is legally allowable for people to sell versus what people should select and eat. And so in the long run, I think the attention would be to stress the importance of food choices, the kinds of choices that people make, so then people don't get into buying things because the advertisement is so intense and it's forcing people to buy certain things. Governments can increase taxes, they can restrict advertising, but those are still legal things that manufacturers do, and there is always going to be that tug of war between nutrition and regulation.
Thank you, Seth. Francesco.
Yeah, no, I think definitely we're making some progress. But first of all, we have clearly identified what are the elements there. So we have marketing food to children. We have the front of the pack labeling. We have fiscal policies, and we have public school food procurement. They can all be regulated, and they're increasingly regulated. We also are developing very clear guidelines with information on cost effectiveness. So I think we have a better base. And also there's some greater consensus around those policies. I mean, fiscal policies, taxation of sugar-sweetened beverages is now applied in 78 countries. And it's increasing. I think that's really important. The Codex Alimentarius has just approved last week the guiding principles on front of the pack labeling. They don't exactly say how they should be done, but they are very clear guiding principles. So I think we have a lot of very good basis for this regulatory measures to be clear, very well described, implementable, and around which consensus can be made. Food industry, maybe we need to change approach. On the one hand, I think the pressure is important. The public, the pressure from the public is important, but we also need to be clear what the ask is. And the approach, for example, we're taking in WHO is to be very clear about the asks on reformulation. So eliminate industrial trans fat, have clear amounts of sodium in different categories of food. Next one will be sugar. So having basically clear benchmarks that then can be reinforced at national level with national target and with national policies.
Francesca, that's great. I was going to push you on the transnational dimension, but I think given time, I'm going to move on to one final question, which I think is a really important one, and it came from Pat McMahon, who said, isn't the nutritional agenda for the first 1,000 days the same as what we're talking about? And I think, Pat, what you were referring to was the fact that this is the next generation to parent, And the nutritional states of adolescents today will be very predictive of the nutritional states of them as they make the transition into parenthood. So a question to our panelists and our presenters: how do we bring a life course perspective to nutrition? Because I think we would all agree that we need a life course and intergenerational perspective. What are the next steps to doing that? One.
George, just briefly. I mean, I think that you said you said it. So we need a life course perspective. We are not trying to compete between adolescence and the first 1,000 days. The first 1,000 days now have visibility thanks to the work done previously. And what we are trying to do now is that adolescence and late childhood should also be visible. So they should not compete. It's really both of them needed for the future the future health of this population.
Well, I think we both said it, Juan. Panima, how do we get there?
I think it's less about how we get there, and I just want to say a little bit about the differences. Though one of the things that I think has been very powerful about the first 1,000 days is, in fact, we agreed on a broad sort of common core of interventions that were applicable wherever you were in this world, whether you were a poor pregnant woman or a rich pregnant woman. We agree on a certain set of principles of nutrition integrated into healthcare and other things. I think the story with adolescence is a little bit different because we recognize that the nutritional challenges, although the road is clear, it's a healthy, nutritious diet that's good for people and good for the planet. But the way that it's approached is likely to be somewhat different in different parts of the world. And so, I think we call for a focus on going local, but still understanding the connections to the ecosystem, as we have discussed so broadly here. So I do think there are some differences, but to me, there is no competition. It's really good food for humanity, good nutrition for humanity here that we have to aspire to.
Unfortunately, we are at time. Mariam, if you had a very, very quick comment, we could squeeze it in.
Yeah, I'm very quick, just to say, to build on what Purnima said, the interesting thing is investing in adolescent girls pre-conception is a contribution to the 1,000-day windows. So that is probably one of the best investments one can do for that period in life. Thanks.
Agree. Look, apologies if we haven't got to your questions. There have been some fabulous questions about things that we covered and things that we didn't cover in the series. So thank you all for your interest. And I'll pass over to Sabina Kleinert for closing. Over to you, Sabina.
Thank you very much, George. Really, really great presentations and stimulating discussion. So let me try and give a very high-level summary first, what we heard. So we have heard from the series authors and the panelists how important nutrition is in this age group and how it has actually until now been woefully neglected. And while a focus on nutrition the first 2 years of age, that's, as we discussed just now, is clearly important for a good start in life and for a child to achieve full potential, adolescence is a second opportunity to reinforce healthy nutrition and even to reset to a healthy trajectory, perhaps. But it's also a phase of risks as choices are made more independently, and especially because food environments are continuing to be shaped by unfettered commercial interests. We've heard what adolescents prefer to eat is heavily influenced by the food environment, peer choices, social, cultural, dietary norms, convenience, taste, affordability. So I think these are areas where interventions are urgently needed. As an added complication and a really unexpected global event that happened during the gestation of the series, COVID pandemic. The COVID pandemic made existing food insecurities, poverty, and inequity worse, with added difficulties to achieve healthy nutrition. So the urgency for change is even more pressing now. So next week at the Nutrition for Growth Summit, led by Japan, there's the opportunity for global pledges. And I think somebody put in the chat that there is still time to do so. So let us hope that national governments will seriously think about using fiscal and policy levers to promote healthy diets for adolescents, one of the series' main recommendations and something we have discussed in the panel discussion. But most importantly, and that came through very strongly too for me, we need to all think about ways how power structures can shift so that adolescents and young people themselves can effectively use their agency. And I would say even beyond a pure advocacy role to bring about transformative change, which clearly is good for them, but also the next generations and the planet. As with all series, we will continue the partnership with our authors and others who want to come on board to monitor change and further push for action in the coming years. And to conclude, I would like to say a few thank yous. So a thank you to the event co-hosts, the Tokyo Nutrition for Growth Summit, which allowed us to run this launch as an official side event to the summit, the Murdoch Children Research Institute, the Global Alliance for Improved Nutrition, our academic partners, the University of the Witwatersrand, the University of South Carolina, Imperial College London, the Emergency Nutrition Network, and the International Food Policy Research Institute. The funders of the series, Fondation Botna and Wellcome, and also the translation services, Prime Production Limited. Together with all series authors, panelists, young people in our videos, and also especially Molly O'Sullivan, who has worked really tirelessly to put everything together for this launch. So that I would like to wish you all a very good evening or a good day. And thank you for listening and participating.
Nutrition is a basic right for everyone.
If our young people are not strong physically, mentally, ethically, it's not possible to think about our good future, about our healthy future.
Adolescent health and nutrition has definitely been neglected.
It's the time to build our body. It's a time to build our mind. It's a time to build as a leader mentally and physically also.
The problem has really transitioned over the years. We are moving out of poverty little by little, but now the focus has to be in terms of what kind of information are you giving to adolescents for them to have the right food.
Education and government politics are the two main things that should be adopted by all countries around the world.
Malawi,
India,
Bangladesh, and
especially in Madagascar.
Our food system is not adolescent friendly, is not youth friendly.
It leads to a vicious cycle in which bad food means bad health, means more stress, potentially more bad food in the future.
Nearly 20% of adolescents in China are overweight or obese. I urge introducing food education into the classrooms.
My call to, first of all, the governments would be that invest in prevention rather than cure.
The change that I want to see in adolescent nutrition systems in my country is that foods that have high nutritional benefits must be more affordable and accessible.
We should give emphasis to the youth nutrition, to the youth health, and to the youth rights.
I see an opportunity here that right now I think the world has kind of opened their ears for young people to be listened to. So we need to capitalize on this opportunity for young people to come together and speak with one voice in terms of what do we want in our communities.
We need more young people to be involved.
Have them in the room, give them a seat at the table, because they are going to be not only the future, but they're also the present.